Welcome to Listen and Learn Medical. The background music resonates at 432 Hz and may help you with better memory retention. Whether you're a medical student, healthcare professional, or just someone fascinated by cardiology, this video is your ultimate guide to 150 essential heart terminologies. Understanding these terms is crucial for mastering cardiovascular anatomy, physiology, and pathology. Each term will be pronounced and explained, making it easy to follow along. So grab your notebook, turn up the volume, and let's dive into the world of cardiology. Here are 150 terminologies of the heart, anatomy, and structures. Aorta, main artery carrying oxygenated blood from the heart to the body. Atrium, upper chamber of the heart. Ventricle, lower chamber of the heart. Septum, wall dividing left and right sides of the heart. Pericardium, membrane surrounding the heart. Myocardium, heart muscle layer. Endocardium, inner lining of the heart chambers. Mitral valve, valve between left atrium and ventricle. Tricuspid valve, valve between right atrium and ventricle. Aortic valve, valve between left ventricle and aorta. Pulmonary valve, valve between right ventricle and pulmonary artery. Pulmonary artery, vessel carrying blood from right ventricle to lungs. Pulmonary vein, vessel carrying oxygenated blood from lungs to left atrium. Coronary arteries, arteries supplying the heart muscle. Chordae tendineae, fibrous cords anchoring valves to papillary muscles. Papillary muscles, muscles that control valve function. Interventricular septum, wall between the two ventricles. Sinoatrial node, SA node, heart's natural pacemaker. Atrioventricular node, AV node, relay station in the electrical conduction system. Bundle of His, pathway for electrical signals in the heart. Purkinje fibers, fibers distributing electrical impulses in ventricles. Chordae tendineae, tendinous cords that anchor valves. Valve leaflets, flaps that form heart valves. Endothelium, thin layer of cells lining blood vessels and heart chambers. Fibrous skeleton, connective tissue framework of the heart. Functions and physiology, cardiac output, volume of blood pumped by the heart per minute. Stroke volume, amount of blood pumped from a ventricle per beat. Ejection fraction, percentage of blood pumped out of ventricles with each contraction. Systole, phase of heart contraction. Diastole, phase of heart relaxation. Pulse, rhythmic expansion of arteries due to heartbeats. Blood pressure, force exerted by blood against vessel walls. Coronary circulation, blood flow through the heart muscle. Cardiac cycle, sequence of heart muscle contraction and relaxation. Arrhythmia, irregular heart rhythm. Bradycardia, slow heart rate. Tachycardia, fast heart rate. Ischemia, reduced blood flow to the heart muscle. Hypoxia, oxygen deficiency in tissues. Angina, chest pain due to reduced blood flow. Aneurysm, abnormal bulging of a blood vessel or heart wall. Afterload, resistance the heart must pump against. Preload, volume of blood filling the heart before contraction. Chronotropy, heart rate control. Inotropy, force of heart muscle contraction. Dromotropy, speed of electrical conduction in the heart. Conductivity, ability to transmit electrical impulses. Contractility, ability of heart muscle to contract. Electrophysiology, study of the heart's electrical activity. Cardiomyocyte, heart muscle cell diseases and conditions. Myocardial infarction, heart attack. Congestive heart failure, CHF, heart's inability to pump effectively. Cardiomyopathy, disease of the heart muscle. Endocarditis, infection of the heart's inner lining. Pericarditis, inflammation of the pericardium. Atrial fibrillation, AFib, rapid irregular atrial rhythm. Ventricular fibrillation, disorganized ventricular rhythm causing cardiac arrest. Heart block, delay or obstruction in electrical conduction. Valvular stenosis, narrowing of a heart valve. Valvular regurgitation, leakage of blood backward through a valve. Mitral valve prolapse, improper closure of the mitral valve. Coronary artery disease, CAD, narrowing blockage of coronary arteries. Hypertrophic cardiomyopathy, thickened heart muscle. Dilated cardiomyopathy, enlarged and weakened heart chambers. Restrictive cardiomyopathy, heart muscle stiffness. Rheumatic heart disease, valve damage from rheumatic fever. Aortic aneurysm, ballooning of the aorta. Pulmonary hypertension, high blood pressure in lung arteries. Cardiac tamponade, fluid buildup compressing the heart. Sudden cardiac death, unexpected heart-related death. Endocardial cushion defect, congenital heart defect. Patent ductus arteriosus, PDA, persistent fetal blood vessel. Tetralogy of Fallot, congenital heart defect with 4 abnormalities. Coarctation of the aorta, narrowing of the aorta. Atrial septal defect, ASD, hole between atria. Diagnostic procedures: electrocardiogram, ECG, EKG, test recording, heart electrical activity, echocardiogram, ultrasound imaging of the heart, cardiac catheterization, insertion of catheter into heart vessels, stress test, exercise or medication to test heart function. Holter monitor, portable ECG recording device. Coronary angiography, imaging of coronary arteries with dye, cardiac MRI. Magnetic resonance imaging of the heart, cardiac CT scan. Computed tomography imaging of the heart, nuclear stress test. Imaging using radioactive substances, blood tests, e.g. troponin. Detect heart muscle injury, pulse oximetry. Measures oxygen saturation in blood, chest X-ray. Imaging of heart size and lung status. Tilt table test, evaluates causes of fainting. Electrophysiology study, EPS. Testing heart's electrical system. Cardiac biopsy. Tissue sampling from heart muscle. Venous Doppler ultrasound. Assesses blood flow in veins. Arterial blood gas, ABG. Measures oxygen and CO2 levels in blood. Brain natriuretic peptide, BNP. Blood test for heart failure. Pulse wave velocity. Measures arterial stiffness. Ankle brachial index, ABI. Compares blood pressure in ankle and arm. Coronary calcium scan. Detects calcium deposits in arteries. Right heart catheterization. Measures pressures in right heart and lungs. Left heart catheterization. Measures pressures in left heart and arteries. Venography. Imaging of veins with contrast dye. Chest fluoroscopy. Real-time X-ray imaging of the heart, treatments and interventions. Angioplasty. Widening narrowed arteries with a balloon. Stent. Small mesh tube to keep artery open. Bypass surgery. Creating alternate blood flow routes around blockages. Pacemaker device to regulate heart rhythm. Implantable cardioverter defibrillator, ICD, device to correct dangerous rhythms. Cardioversion, electric shock to restore normal rhythm. Thrombolysis, clot dissolving treatment. Valve replacement, surgical substitution of damaged valve. Valve repair, surgery to fix valve function. Heart transplant, replacing diseased heart with donor heart. Ventricular assist device, VAD, mechanical pump to support heart function. Beta blockers, medications slowing heart rate. Calcium channel blockers, medications relaxing heart and vessels. ACE inhibitors, medications lowering blood pressure. Diuretics, medications increasing urine output to reduce fluid overload. Anticoagulants, blood thinners preventing clots. Antiplatelets, medications preventing platelet aggregation. Nitrates, medications dilating blood vessels. Statins, medications lowering cholesterol. Heart rehabilitation, program to recover after heart events. Cardiac ablation, destroying problematic heart tissue causing arrhythmias. Endarterectomy, removal of arterial plaque. Thrombectomy, removal of blood clots. Defibrillation, emergency electric shock for cardiac arrest. Extracorporeal membrane oxygenation. ECMO, heart-lung machine support. Other terms and concepts. Angiogenesis, formation of new blood vessels. Cardiogenic shock, heart's failure to pump sufficient blood. Collateral circulation, alternate circulation around blocked arteries. Electromechanical dissociation, electrical activity without heart contraction. Fibrinolysis, breakdown of blood clots. Hemodynamics, study of blood flow dynamics. Lumen, inside space of a blood vessel or heart chamber. Murmur, abnormal heart sound, palpitation, awareness of heartbeats, plaque. Fatty deposits in arteries. Precordium, area on chest over the heart. Purkinje network, specialized fibers in heart conduction. Sinus rhythm, normal heart rhythm, originating from SA nod. Esystolic pressure, pressure during heart contraction. Diastolic pressure, pressure during heart relaxation. Thrombosis, formation of blood clot. Vasodilation, widening of blood vessels. Vasoconstriction, narrowing of blood vessels. Venous return, blood flow back to the heart. ventricular hypertrophy, thickening of ventricular walls, Wolff-Parkinson-White syndrome, abnormal electrical pathway causing arrhythmia, aneurysmectomy, surgical removal of aneurysm, cardioversion, procedure to restore normal rhythm using electric shock, myocarditis, inflammation of heart muscle, pericardiocentesis, removal of fluid from pericardial sac. And there you have it, 150 must-know heart terminologies to boost your medical knowledge. We hope this video helped you strengthen your understanding of cardiovascular terms, whether for exams, clinical practice, or personal learning. If you found this helpful, don't forget to like, subscribe, and hit the notification bell so you never miss our future medical terminology breakdowns. Have any requests for our next list? Drop them in the comments below. Thanks for watching Listen and Learn Medical. Keep studying, stay curious, and see you in the next video.